Hello, Dr. Richard Harris here, clinical advisor for CBD Health Collection, and this is our CBD Journal Club. We're all about full transparency. I am a paid advisor for CBD Health Collection, but it is the CBD I actually use in my home. And this journal club is to help educate you about what science is doing with CBD. There's a lot of studies coming out each and every week where scientists are testing different aspects of CBD. So this study, the title is Cannabis Use and Effectiveness, Real World Evidence from Canadian Medical Cannabis Clinic. This study looked at, hey, we've got some real people who have been on CBD for a while, and let's see how it helped them. In the background, we know that CBD does not cause intoxication or euphoria and has low abuse potential, which is great. This is the type of thing you want as an ideal treatment modality. And CBD has been studied for social anxiety, schizophrenia, Parkinson's, and substance use disorder. It's actually being studied a lot for opioid use disorder and helping people come off of opioids, which is always a good thing to hear. Now, the randomized clinical trials, or RCTs, which is the second highest level of evidence for CBD, are limited by their design. They have smaller sample sizes. They're typically shorter studies. And so long-term data is kind of scarce. But don't let that scare you. Let's dive into what this study's showing. Real-world evidence from retrospective studies, which are you collect data from the real world and you look back in time. So these people have been using it, they've been getting assessments, and then you look at that data afterwards. So these real-world assessments from retrospective trials show CBD is used for pain, mental health, cancer, and neurological symptoms. The Edmonton Symptom Assessment Scale, or ESAS, ESAS, is a scale that's used to assess symptom burden, and it's often used in oncology and palliative care. An improvement in ESAS scores in previous studies with ECS supplementation were shown in depression and anxiety, but not with pain and well-being. This study wanted to look at CBD-rich products, so they actually looked at products with CBD and then some with a combination of CBD THC on pain, anxiety, depression, and overall well-being. Now, how did they do this study? Well, it was a retrospective analysis, meaning they looked back at data from patients on an initial visit, 3-month visit, and 6-month visit. And these were adult patients between October 2017 and May 2019. Some of the patients were actually changed from CBD to CBD THC, and some just use CBD only. And that ESAS score, it goes from 0 to 10, and symptoms include pain, depression, anxiety. 0 to 3 is mild, 4 to 6 is moderate, and 8 or above is severe. Clinically, previously, a significant improvement is a decrease by 1 point. And this study investigated the effects on pain, depression, anxiety, and overall well-being. And they looked at 2 different groups, the moderate severe group and the mild severity group. What did the results show? 279 patients were analyzed, 210 for chronic pain, 19 cancer, 21 for neurological disorders, 8 for inflammatory disorders, 10 for GI, 2 for anxiety, 1 for depression, 2 for headaches, and 6 for unclassified. At the follow-up, 116 added THC, so they were able to see if there was a difference between CBD alone and CBD THC products. 203 had moderate to severe symptoms on 2 symptoms, 57 had on 3, and 75 on 4. The max dose of the CBD was 156 milligrams, which is a dose that you can often see for chronic pain, especially cancer patients, or for neurological disorders. The max THC dose was 90 milligrams. What did they find? Well, ESAS scores decreased significantly between baseline and follow-up 1 for all symptoms, and between baseline and follow-up for anxiety and well-being, but not between follow-up 1 and follow-up 2. So they got a decrease in the scores, a significant decrease between the first follow-up, between baseline and the first follow-up, but not follow-up 1 and follow-up 2. Now, what this means is that the benefit seen at 3 months was sustained at 6 months. There was, in this study, a maximal benefit that was achieved in 3 months, and that sustained on the 6 month. So that's a good finding. It means that in this study, at least for a 6-month period, the initial findings were sustained. There was a difference of 1.3 to 2.5 points in all symptoms for patients with moderate to severe symptoms. Remember, we said earlier that a decrease in 1 is significant. However, the mild patients showed a much greater variability between zero point 0.3 to 1.8, and overall, there was not a significant difference in the mild patients. Pain, anxiety, and depression saw improvements for severe symptoms, but in fact, the mild anxiety worsened. And this is something we've seen in a couple of studies, that patients with mild symptoms may actually experience worsening of their symptoms. And that might be not related to CBD. That might be if they have mild anxiety and they're taking something, then they're progressing on to severe anxiety. What I think would be interesting is following these people for a longer period of time and seeing once they progress to severe anxiety, does the CBD actually help them? Because how CBD works and how all the cannabinoids work is the ECS system, the endocannabinoid system, is all about balance. It really helps to make sure that our systems are functioning optimally. So if you have a mild dysfunction, then the taking a cannabinoid product may not help you as much as if there's a severe dysfunction, because there's more work for the CBD actually to do. There's more need to actually balance the systems, the more dysregulated and more disrupted the systems are. So in the discussion, overall, the authors found that the CBD is primarily effective for moderate to severe symptoms, and they theorize that a deficiency in some of these endocannabinoids, our own cannabinoids, may be more apparent in moderate to severe symptoms, which makes sense. The greater the deficiency, the more severe the symptoms. And as we talked about earlier, there is a discrepancy in the literature about anxiety, where some find positive, others negative. And I think that could be due to duration, could be due to dose. There's a lot of factors there. The addition of THC to CBD did not produce any difference in scores. I thought that was really interesting. And the average daily dose in this study was 11.5 milligrams, which is a real world dose. As we've talked about before, most people equilibrate on somewhere between 20 to 40 milligrams of a daily dose. Limitations of this study: it was a retrospective study and it did use self-reported data. Also, there's some issues with self-selection bias, meaning people had to come to the clinic and express interest in CBD. And so you're only dealing with a small subset of the population who aren't afraid of the social stigma, who can pay the cost, and there's less economic barriers. Also, there was a lot of missing data, so the sample size was smaller, which can sometimes, well, it's not sometimes, it can affect the results, meaning that it makes the results a little less valid. You're a little less sure of the results. And then there was no safety analysis. In this study, other studies have shown that it is generally safe. It can interact with some medications. So if you are on medications, like we always say, get with a professional who knows about CBD. The main takeaway is there's a reduction in pain, anxiety, and depressive symptoms, overall well-being for those who have moderate to severe symptoms. Well, thank you for listening to the CBD Journal Club. If you're interested in CBD health collection products, check the link below. We'll probably be doing these maybe 2 a month, depending on how many good studies we can find to come and talk to you guys about. All right, have a blessed day.